It's a major concern. What if someone in your family suddenly becomes ill in the middle of the night and you can't find an open drugstore? There are some over-the-counter medicines you should keep in your cabinet just in case. Dr. Mallika Marshall has a list of medicine cabinet must-haves. Doc, good to see you this morning.
You too, Chris.
But I guess before we talk about the must-haves that you should have, you really need to know what you shouldn't be taking just in case it makes matters worse.
That's right. These are recommendations for the average American family, but obviously there are people who have certain medical conditions who are taking certain medications that don't mix with over-the-counter remedies. So if you have any concerns, talk to your doctor first, and if you have young children at home, ask your pediatrician what you should be giving them.
Okay, we've got a number of items lined up here. Let's talk about items that would probably be best served if you've got a nasty cold or something like that.
Yeah, we're heading into cold and flu season, and there's summer colds around there too, so it's always important to have these things on hand. You might want to start off with something like a decongestant. You know, a lot of these things come in combination remedies, but they tend to be more expensive and you can get into trouble with mixing them. So stick with individual ingredients. So a decongestant like phenylephrine, for example, found in Sudafed. Then you might want to invest in an antihistamine, so something like diphenhydramine, which is found in Benadryl, or one of the non-sedating antihistamines like loratadine or Claritin. Also for cough, stick with something like dextromethorphan, which is a cough suppressant, which you can find in Robitussin, and all of these things come in generic versions that are a lot cheaper. And then for nasal congestion, especially if you have a baby, simple nasal saline drops, which is just salt water. You can stick it in your baby's nose and suction it out. Very helpful.
It's funny you talk about summer colds. I had one. And then, of course, I didn't realize whether it was a cold or whether it was allergies. And some of these things, obviously, are for allergies as well.
That's right. So you want to stick with your antihistamines for allergies, sedating and non-sedating versions. Sometimes, to be honest, you want to be sedated. So you can pick those.
Exactly how I felt those 2 weeks that I was so under the weather. How about fever? Now we're upping the ante a little bit. Not just a cold, but you're really, really worn down.
Right. So there are two main fever reducers. There's acetaminophen, which is the active ingredient in Tylenol. It comes in both adult and children versions. And then there are the anti-inflammatory medications, which also reduce fever. One of the most popular is ibuprofen, active ingredient in Motrin and Advil. So again, there are children's versions. Check with your pediatrician about the dosing. And remember, if your kid has a fever, do not give them aspirin because they can get into trouble with that.
Okay, now pain. Okay, and I'm not just talking about, what's the difference between, let's say, if I've got a headache or if I'm playing softball, pull a hamstring, sprain an ankle, something along those lines, which I have done this summer as well.
Absolutely.
Not very healthy.
Colds, hamstring tears. If you have just sort of a run-of-the-mill headache or just a general pain, then acetaminophen or Tylenol is just fine. But if you have inflammation or swelling, then you want an anti-inflammatory medication. So again, you're talking about ibuprofen, aspirin, or naproxen, which is the active ingredient in Aleve, and have an ace bandage around just in case.
All right, tums to tum-tums. We're talking about belly aches now.
Now, a lot of belly aches, people, as soon as their stomach starts to hurt, they immediately reach for medication. But there are a lot of things that simply just need belly rest and clear liquids to stay hydrated. However, if you decide you need a medication for heartburn, for example, Tums or calcium carbonate is your best friend, or something like Maalox or Mylanta. And if you have diarrhea, then you can reach for something called Imodium. And if you have kids that have vomiting and diarrhea, then you probably want to have a rehydration solution around just in case to keep them well hydrated.
Cuts, burns, scrapes.
Yeah, so this is your general first aid category here. And, you know, a lot of people reach for hydrogen peroxide and betadine if they have a minor cut or wound, but sometimes these can actually slow healing. So you probably don't need these. Plain soap and water is really all you need to clean most cuts and bruises. You might want to have an antibiotic cream like Neosporin or a triple antibiotic ointment around, cotton balls, scissors, tweezers, alcohol, and of course your Band-Aids.
And of course some stitches.
No stitches,
sutures.
no, leave that to us.
All right, now we've got some bug bites, little things like that. Need some of these items. Who doesn't get stung by a bee here and there?
Absolutely.
Rash, of course.
And you're going to laugh at me because this is something you would generally find in your kitchen cabinet and not in your medicine cabinet, but it is meat tenderizer.
Really?
This is great for neutralizing the venom from those stinging insect bites. So things like wasps and bees, just mix it with a little bit of water to make a paste, use a cotton ball and put it on the wound, and it can take the sting out. And then obviously
throw it on your steak.
Yeah, or throw it on your steak too. And your hydrocortisone creams will help with itching and inflammation. Calamine lotion helps with itching as well.
And of course there is that phone number everybody needs to know, poison control.
That's right. If you have young kids around, keep these things locked up. If they get into trouble, call this 1-800 number, get help.
All right, Dr. Mallika Marshall, thanks.
Thanks,
Good to see you as always. For more on medicine cabinet must-haves, just go to our website at earlyshow.cbsnews.com.